Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and today we're going to talk about a topic that is very popular on this show, PCOS. But we'll add a little spice and focus in on some areas that might actually be new to you. We'll really look at some more nuanced inflammatory markers and the lifestyle factors that influence them. Joining me today is my longtime friend and mentor, Dr. Yousef Elyaman. Dr. E is a board-certified physician, actually certified in both internal and integrative medicine with a cross-specialization in pediatrics. He's the medical director at Human, and listeners of this show know that I love their beetroot products. He's the founder of Absolute Health, which is a primary care and functional medicine clinic in Florida. He's a trauma and recovery expert, a national educator and speaker, and just all around fun to hang out with. So I'm really delighted to have him on the show today. Welcome, Dr. Elyaman.
Thank you so much.
Well, to give our listeners a little background, you and I have been working together for a lot of years. And one thing I've always appreciated about you is your ability to anticipate what's coming next. Like you're always looking at the next guidelines, the next biomarker. I was laughing to myself this morning thinking it was a couple of years ago and you and I were meeting and you said, hey, there's this new thing that you should check out. It's called ChatGPT. You're always anticipating. So my question that's selfishly coming from me as a clinician, how do you stay up on all this stuff? Are you just always researching, always looking at PubMed? How do you know what's coming next?
Yeah, a bit of ADD and a bit of I'm always looking for ways of not doing paperwork. So I just start researching. Actually, now instead of PubMed, it's now looking at AI and asking questions.
Yeah. Well, you taught me that. I really appreciated that. Well, today's episode, like I said, we'll talk about PCOS, but we're focusing on some of these biomarkers that not a lot of people are talking about. And I think the listeners of this show by now are familiar with insulin resistance. We talk a little bit about, HSCRP, some of these more standard inflammatory markers. But a few years ago, you started talking a lot about uric acid. And I was listening up because this isn't something that I was measuring at all. And then you started talking about the role of uric acid in PCOS. And I really started listening and I thought we have to talk about this on the show. So I think uric acid is probably really new to most people who are listening. Will you just tell us a little bit about what uric acid is and why it might be elevated in people with PCOS?
Yeah, absolutely. And I'm glad that we're getting to talk about this because I do think it is a missing piece and a missing link when it comes to not only PCOS, but just good overall metabolic health.
Yeah.
So what uric acid is it's a disorder of purine metabolism. Purines are these sugar bases that we have in the body, and our body breaks them down. DNA is made of it, our genetic material. And when our body breaks it down, or when it breaks those sugars down, we end up getting this byproduct called uric acid. And in small amounts, uric acid actually may protect us against neurologic damage, so issues with the brain and our nerves. But when the level starts going up high, it actually increases our risk of multiple things and things that patients or people with PCOS definitely want to pay attention to, because women with PCOS do have higher amounts of uric acid.
After I learned from you, I started measuring it. It was true. I
Yeah.
really was seeing elevated uric acid. And I think it's important what you point out is like at low levels, it might be protective, but at elevated levels, it's more pro-inflammatory. I always talk about it's like famous for causing gout, right? But you can have levels below what would cause gout and still have issues. So talk to us a little bit. You mentioned the purines, like what's going on in our diet or lifestyle that's going to make us have a bunch of purines that we're going to metabolize and make all this uric acid? Is it the foods we're eating? Is it the things we're doing?
Yeah, it's really kind of a combination, but it's highly driven by food. But I kind of wanted to point something out. Like the thing with uric acid, for us in the medical field, medical community, we're only looking at uric acid really when it comes to, you mentioned gout, and gout is a condition where you end up getting these uric acid crystals that deposit in your joints and cause joint pain. It's red, it's inflamed. Anyone that's had a case of gout knows they don't forget about it. Usually it's the large toe that gets red and inflamed. But the thing I love about functional medicine is that we're looking at root cause and we're looking at genetic variances. And if you look at it, around 21% of our population has high uric acid, according to the current lab standards, but only around 3.9 or less than 4% have gout. So from a genetic point of view, what happens is that some people genetically, if their uric acid is high, they get gout. And other people, if their uric acid is high, they get oxidative stress or rusting. They also can get fatty liver from it, and they get low nitric oxide, which you need good amounts of nitric oxide for blood flow to the organs that the reproduction organs in the first place. So I just wanted to kind of mention that it's not just about uh, gout. It's about the patient, and high uric acid will do something, will do a certain thing to one patient, but a different patient with different genes, it will do something different. And the original question you were asking is like, why is this uric acid going up in the first place?
Yeah.
This I think is going to just throw people. It's going to make people think as well, because it's not. This is unfortunately this isn't like the common knowledge. Everybody thinks that it's from eating, from drinking beer or eating high purine foods like
Mm.
meats,
Organ
like
meats or something. That's what
the
I thought.
organ
Yeah.
meats. But it turns out the main thing that's driving this is high amounts of fructose.
Mm. Hmm. Yes. Okay. So I've heard you speak about this before, and it's been haunting me. Can we eat fruit? Is that safe?
Yeah, we absolutely can eat fruit, but it depends on what type of fruit and what you do afterwards. So this is what happens. If you look at just sugar, table sugar is sucrose. And sucrose has two sugars in it. It has glucose, which we're looking at with diabetes, and it has fructose. And if you want to be very fancy, the people that listen to this show are going to they're going to go hang out with their friends and be fancier. They can say fructose when they're feeling like they want to,
Very
yeah,
fancy.
yeah, a little fancy twist. So what happens is that like every sugar molecule has both. It has a glucose and it has a fructose. Now the fructose, our body is designed to be able to take maybe 8 to 12 grams of fructose at once, and when we do that, the body just uses it. But if you go past that in one sitting, what ends up happening is that the liver has to work harder to process the fructose. And when it does that, it has to use up ATP. And the
Mm.
A in ATP is our major energy source.
Yeah.
That A, so it decreases their energy, but the A in ATP breaks down into uric acid. And it
Mm.
tells the body to store fat. It decreases nitric oxide because you don't need blood. If you think about what it is that why it is that our body would do this, it's because there when we would get access to food, when we'd get access to high amounts of fruits, our Stone Age ancestors, then we needed to be able to store fat for those times of famine.
Yeah.
So it sends a signal. It tells the body, hey, relax, slow down. You don't have to run around and hunt. So it doesn't want you to burn calories. It decreases circulation because you don't need to increase metabolic processes. Slow down, gain some fat. It actually
Yeah.
wants you to gain some fat. And then and it helps you kind of hibernate and store fat for the future.
Hmm. I'm so glad you're making these connecting points, like between the circulation and the nitric oxide. It's something we talk about on the show a lot because of the effect on endometrial receptivity and blood flow through the ovaries. But I guess what I'm trying to visualize in my brain is what makes women with PCOS more susceptible to like or more predisposed to elevated uric acid? Is there something physiologically happening? What's the connection?
Yeah. There's a couple of things. So number one, women with PCOS, they tend to not have as robust detoxification enzymes. They
Mm-hmm.
still can, in the right environment, as you see, you can give them the right lifestyle, the right food plan, and they're fine. They do fine. But if you look at today's society that kind of overloads us with toxins, they're not really good at dealing with toxins. And what happens is that you end up in this kind of uric acid increases oxidative stress, which increases insulin resistance,
Yeah.
which can
Okay.
increase blood sugar. And I'll tell you what happens. High blood sugar, your body wants to do something with it, especially for those PCOS patients who now they're checking their blood work, and their blood work is now showing an elevation in blood sugar. Glucose goes through a pathway called the polyol pathway, and it turns into fructose because the body knows it shouldn't have a lot of glucose floating around. So it tries to fix it. So it shunts it over to fructose. In the process, it becomes sorbitol, and then from sorbitol, it becomes glucose again. And this is what happens. Your body starts to deplete inositol. And if you
Mm.
look at one of the supplements that we like to use in our PCOS patients, myo-inositol, right?
Yep.
So it starts depleting the inositol, and then that uric acid, when the uric acid is up, it actually tells the body to make more uric acid, and they get caught in this vicious cycle.
Hey everyone, let's take a moment to talk about sleep. Sleep is incredibly important for fertility, to keep our hormones healthy, to power up our antioxidant capacity, and to help us deal with inflammation. I find that the uncertainty or anticipation in the preconception timeframe can make us feel a little on edge. It can be more difficult to find space for restorative sleep. As a busy mom and business owner, I find myself feeling wired but tired at the end of the day and really craving something gentle and effective to help me wind down. I've recently started ending my day with the sleep and relaxation support by Needed. This is a delicious chamomile-infused powder that you mix into water. I've been mixing mine with some warm water for a cozy and nourishing ritual before bedtime. The sleep and relaxation support is really yummy, like a slightly sweet chamomile tea, but it has no added sugar. It's sweetened only with monk fruit. It gives me a boost of calming ingredients like magnesium, glycine, and L-theanine to promote optimal sleep quality and relaxation. I'm also so grateful to have a product that's safe for pregnancy and breastfeeding. Most sleep aids are contraindicated for pregnant and nursing mamas, and we know how important sleep can be during these life stages too. If you're ready to relax safely and deliciously with Needed's sleep and relaxation support, head over to thisisneeded.com and use code Functional Fertility for 20% off your order. That's thisisneeded.com and use code Functional Fertility for 20% off your order. It's all starting to come together for me. So we talk a lot about chronic inflammation on this show. So I think our listeners are pretty familiar with chronic inflammation making you more insulin resistant, among so many other things. But what's the connection between elevated uric acid and chronic inflammation?
Okay. The thing that makes them get elevated uric acid is lots of sugar, right?
Mm-hmm. Yep.
Glucose and fructose, and the glucose can turn into fructose. Lots of sugar and elevated uric acid causes what we call oxidative stress. And oxidative stress, when your liver is stressed, it can actually increase inflammation. Insulin resistance can also cause an increase in inflammation as well. And it's a combination of things too. The kind of foods that people will take in that push them to having higher sugar levels and higher fructose levels, higher glucose and fructose levels, those foods tend to be foods that feed bad bacteria in the gut,
Mm-hmm.
which also will contribute to inflammation. So there's like multiple things that are happening. And then
Yeah.
there's something called advanced glycosylation end products, where those sugars, and fructose can do it as well. Glucose and fructose create these byproducts that cause inflammation and oxidative stress. So there's like so many things that are kind of pushing towards, it's like a lifestyle that pushes us towards inflammation.
Yeah. Oh, I'm glad you mentioned ages because I don't think we've talked about that specifically on this show before, but there's some research coming out that shows that women with PCOS have higher levels of ages and that they concentrate in the follicular fluid and damage the oocytes. So what a
Wow.
connecting point here.
Nice. I didn't know that. But yeah, age is what, one of my passions is getting to the root of fatty liver disease. And that's one of the things we need to be mindful of. And there's two types of ages. So there's ages that our body creates within us,
Mm.
but also there's ages that we take in. So whenever you cook foods, you cook sugar at high temperatures with like baking or like high baking or like frying.
Crying. Yeah.
Yes, with fats, with proteins, it creates those ages, and those ages cause an issue as well. And that's why going to more of a raw food plan, maybe gently sauteed versus the French fries and potato chips, would be really good, especially when we're trying to reset the system. And I really want to just kind of point out, a lot of times people will freak out and say, "Does that mean I'll never be able to, or I'll no, we meet people where they're at.
Yeah.
Sometimes though, sometimes you just got to reset, and you do some
Reset.
sort of a cleanse or a reset, and you just eliminate, you start eating, give yourself a month of eating very, very healthy, and then you can reintroduce things, some things that are maybe moderate, some things that might not be that healthy, but it can't be like the predominance of what they're taking in.
Yeah, I mean, if we think about that bucket analogy with inflammation, right? It's like you only are symptomatic when the bucket overflows. So drain the bucket a little bit, and then you can tolerate a couple drips into the bucket, you're okay. Now, if
Absolutely.
anyone's listening, they're like, what do I do about these ages? If you go to my page and you scroll back into the summer, I did a post. It's like guide to grilling and barbecuing this summer. And it talks about ages and how you can mitigate some of the effects by, like marinating meat and herbs and lemon juice and all these things. So go back if you need to. But this is all, I love how this is functional medicine, right? Like we can all of a sudden see all these threads that are connecting all of these different parts of our physiology. And I think now I have a good idea. I wanted to ask you about risk for preeclampsia because when I first started talking about uric acid, some of my OB friends were like, oh, yeah, we've been measuring this in early pregnancy because it helps us to predict people who are going to develop preeclampsia. Will you talk to us a little bit about why that might be a good idea?
Yeah. So first of all, we know that people with insulin resistance and high sugar tend to be deficient in magnesium. And one of the treatments is we give IV magnesium, right?
Right.
So
Yeah.
that can be a piece. But the other piece is that higher amount of uric acid is pushing you to it's sucking up your body's nitric oxide. And if you start sucking up the body's nitric oxide causes your vessels to dilate. You start sucking it up, and now they have vasoconstriction, which is pre-eclampsia. And then eclampsia is now the liver is affected because now it's kind of playing this toll on the liver.
Yeah, yep, that makes good sense to me. You know what? It's interesting. In my last pregnancy with my daughter, who's 7, I had pregnancy-induced hypertension. It didn't quite progress to preeclampsia, but I had hypertension that came on in pregnancy. Afterwards, postpartum, I measured my uric acid, and you know what? It was a little high. I was really surprised, and so did a lot of work to lower all the lifestyle things we're going to talk about in a minute. And I'm so glad that I had that information. And I guess that leads me to ask you, why does it feel controversial to measure uric acid? It's like available at all the labs. It's $4 at LabCorp. Why are we all not measuring this?
Yeah, I honestly, I when I started finding out about it, I asked myself the same question. It's like sometime I don't get me wrong, I wouldn't want to live in a world without all our medical breakthroughs and technologies, but on the other hand, like sometimes we get so tunnel visioned, and I'd like to point out like the number I gave you, the 21% of the population that has high uric acid, that's greater than 7, which is It's that's the bigger risk factor for gout, and that's conventional laboratory cutoffs. But
Mhm.
the data is actually showing, if you could look at these population studies, that you know what, six is high as well.
Yeah.
And kind of my own research, kind of going through the data and looking at what the experts are saying, my cutoff of uric acid is going to be less than 4.5 in women that are trying to have children. And for
Yes.
postmenopausal women and for men, 5.5 is that cutoff. So I think a lot of people need to know that just because the lab says it's okay doesn't mean it's okay. But to answer the question, why is it feel so weird? I don't know. I added it to the panel so I don't have to specifically ask for a uric acid, so I don't feel weird anymore. I just get a panel. But yeah, it's one of those things.
Yeah, it's on my standard preconception panel now. I get it on everyone. I think I reached out to you about this maybe a year ago and said, "What's your upper limit?" So mine's been 4.52. I looked at some fertility specific research, and like you said in the beginning of this episode, you also don't want it too low. So I've been trying to get it like between 2.5 and 4.5. That's been my I've never actually had someone be too low, but that's
Yeah,
my
yeah.
range I'm looking for.
And there's various reasons why they would be low. Part of it, it would be people that are they don't have enough nutrition. So maybe some of your people with anorexia or
Yeah.
yeah, where they have a lot of muscle wasting and now the muscle is gone. So it's keeping them exercising and by far the having it high is definitely more common. So now you have two markers. So you have your patients that have PCOS. You look at your insulin resistance score to see what's happening with their insulin and insulin resistance. Then you can look at your A1C to see if their average blood glucose is high, and then you can look at your uric acid to see if their overall fructose is high. So now you have three different things that you can look at, and everybody genetically is different. So some may go more towards the fructose and uric acid, some may go towards the A1C, and some may just have the insulin resistance piece. And a lot of times you see them all together.
Absolutely. It's something we talk about in functional medicine is pattern recognition, right? And seeing how when I see this, I often also see this. And I'm wondering if in your patients who have elevated uric acid, if you often also see an elevated HSCRP, which is an inflammatory marker that I feel like a lot of people are running. Do you see that happen often?
I do, and I want to, because we're talking about PCOS, I want to talk about another pattern that I think is very important for our listeners to hear and for
Mhm.
clinicians to hear as well, because I know a lot of clinicians jump on and listen to your show as well.
Yeah, yeah.
So yes, there's the high that same lifestyle that drives the high uric acid drives high sensitivity CRP. When you have there's three numbers, and if you see those three numbers high and they stay high, you have to think that those patients have toxic overload, chemical toxic overload till proven otherwise. And this is where we go on a detox. And our PCOS patients are very susceptible. We know that they have a higher chance of ovarian cancer in some research, and like their detoxification pathways need to be cleaned, right? They need to be kind of taken care of. So the uric acid being elevated, according to the standard we mentioned, that in childbearing women greater than 4.5, that would be one.
Yep.
The second is going to be if they have an elevation of GGT. And GGT is known, it's one of those things that kind of feels weird checking until we kind of do it enough times, right? Because we traditionally were taught that GGT is a liver enzyme, and if it's high, it tells you that the liver is kind of over fired up. But the reality is that a lot of our biochemical processes that happen in the body are actually happening in our liver. And what is a high GGT? It's telling you that the body is using up lots of glutathione. And women with PCOS and with infertility, they're depleted. They don't have enough glutathione. That's one of the things that is going on. So if you have that high uric acid, that high GGT, and the third thing, which is usually missed because the lab gives you a different range, is an elevation of ALT, that liver enzyme. And what the ALT cutoff is in women, they've done large population studies and they found the cutoff is going to be 25, not what the lab says, which is like 30s and
40
40s.
something, right?
Yeah,
Yeah.
yeah, yeah, yeah. So when you see those three and they're persistently up, you gotta really help their detoxification pathways. Things like ubiquinol, things like NAC, and maybe do a cleanse where that you're just figuring out what are they putting on their body that's chemical wise. How do we decrease the chemicals we're putting inside us? And then how do we really push to get those chemicals out of our system?
Yeah. Oh, I'm so glad you mentioned GGT. That's another one I've added to our preconception panel. And even when you order this standalone, it's like $11. It's very accessible and it gives you such good information. So I'm so glad that you mentioned that. And the environmental exposure piece, I think we take for granted for PCOS, for unexplained infertility, for a lot of different things. And I'm doing a program with a group right now. It's called 75 Fertile. And for 75 days, we're doing all these different things. But one of our goals is every week we're swapping a product. This week we did shampoo and conditioner because these things like touch your entire body, right? And they all contribute to this body burden. So I'm glad that you mentioned GGT because that should be on the list. So our listeners are probably thinking now, okay, I get the uric acid. Maybe it's a little elevated. What do I do?
So, hydration.
Yep.
So, it's we say it over and over and over, and I'm going to continue to say it because one of the things that is going to trigger an elevation in uric acid is going to be people being dehydrated or eating too much salty foods. Because what happens when we're dehydrated, the concentration in our blood you're going to have a more concentrated blood. And the way the body can tell it's more concentrated is it looks at the amount of sodium or salt. So what happens is if you're dehydrated or you're eating too much salt, that's going to push the body to increase uric acid as well. Now, why is that? Well, if you look at camels, they were designed to be able to deal in the desert. Now, what is the big thing that's different about the desert? Yes, it's really hot, but so is Florida. It also doesn't have that much water.
Mhm.
And that hump on the camel is actually made of fat. And when your body breaks down fat, it turns into energy and water. So what happens is that if your body starts to think that you're dehydrated, then it's going to push your uric acid levels up so that you can store fat so that and that high uric acid is going to decrease your nitric oxide so you don't need as much blood flowing to all the different organs,
Yep.
which that's the anti-recipe for getting pregnant.
Yes. Mm-hmm.
Did I answer what was your
Yeah.
original
Well,
question?
I'm like, what do we do about our elevated uric acid? And you're saying first step is
Okay,
hydration.
water. Yes,
I
yes.
usually tell people half their body weight in ounces of water daily. Is that your rule of thumb?
Yeah, or 8 cups, or I
8 cups.
like
Yeah.
start your day with 16 ounces of water. Most of our patients are on supplements, so you know what, take your supplements with 16 ounces of water first thing, and now you
Yep.
have to six more. But whatever gets it going, whatever can get people constantly drinking water and their body used to staying hydrated. So that's going to be really big. The
Yep.
other thing is that yes, you can have fruits, but be careful with some of the smoothies because if you start adding the really higher sugar fruits,
Yep.
that's something that can maybe able to kind of fire it up, especially if you start going to juices because the juices don't have the fiber that slow the rate, and it's that rapid rise of the glucose and fructose. So that rapid rise of the fructose that hits the body to start turning it into or using energy to make it and then creating this uric acid. So
Mm-hmm.
so so staying away from juices, stay away from I know in AFMCP the course that physicians and other healthcare providers take to be certified in functional medicine, they talk about it's called they call them dessert coffees. right?
Yeah.
So stay away
Yep.
from dessert coffees, right? Stay away, try to not get a lot of sugar in what you're drinking.
Hmm.
And then alcohol is really a big alcohol can really hurt people with PCOS. And
Yep.
we can talk about this later. It'll increase something called homocysteine, which we find high in PCOS, but it also, especially beer, increases the chance of it becoming uric acid. And then so but if you can decrease the sugars and if you can increase the fluid and working out can be helpful because it holds on to muscle, because muscle breakdown can cause it. There are some supplements that may actually help with uric acid as well.
Will you just speak a little bit to protein? Because people will say, I have PCOS. I'm trying to be really aware of my blood sugar. So I'm eating a more, high animal protein, lower carb diet. But now I'm worried about the purines. What do you think?
Yeah, so I think you follow, make sure you're hydrated, you follow the level. Keeping packing on muscle is extremely important
Yeah.
for overall health. And that's where you kind of try to strategically get your protein around your workout so your protein goes into the muscle. It's when the muscles start to break down that actually can elevate the uric acid. It's really a balance. It's really a balance. I mean, and you could do something like branch chain amino acids, and data was showing in sports nutrition world that if you take in branch chain amino acids like before working out, it may actually lower the uric acid.
Interesting. Okay. I've never looked this up and I've never looked at research about this, but what you're saying kind of makes me want to avoid prolonged fasting in those who have an elevated uric acid because of the muscle breakdown piece.
So that is a thought. That is a thought. However, if you the data shows that if you work out, either cardio or resistance training, even on even on food plans that are going to be deficient or surplus of some of these things. But if you work, even if you create like a deficiency, if you work out, you should hold on to the muscle. But yes, the prolonged fastings, you definitely, in the long run, because they're not eating foods that are going to trigger the fructose, which I'm sorry, trigger the elevation in uric acid,
Yep. Yep.
it should even out and eventually go down. But
Okay.
that's kind of, I'm kind of with you. I prefer to do 15-hour fasts and then 24-hour fasts
Yeah,
and get them active and moving so that they're not having muscle wasting.
that makes sense. So, in our patients that have PCOS, how often should we measure uric acid? Okay, we do it at baseline. When do we repeat?
If it's high, you could check it within a month
Okay.
and try to get
Okay.
it down. Otherwise, kind of like you said, it's part of your panel. It's $4. I mean, we
Yeah.
anytime I check, I'm a primary care doctor, and anytime I get a lipid panel, I'm checking it. I'm checking the liver enzymes. I'm checking and I'm checking uric acid. It's just part of my panel.
Yep. Okay. Good. I mean, I love the idea of being able to track it. I think when you see your biomarkers improving, it's so motivating to keep on your plan. So I love the idea of being able to monitor this over time.
Yeah.
Are there any myths or misconceptions about uric acid or inflammation or any of the things we've talked about today that you want to clear the air?
Yeah, first of all, uric acid being elevate or uric acid isn't just about gout, which we've already cleared.
Yes.
The second thing is that our bodies are designed or we're designed to live in a particular environment. And our environment is what we eat and what we drink and our exercise and our stress management and our sleep, right? So there's a certain environment that we kind of were built for. And and I don't like it when people will look and say you have high uric acid because of your genes. Because
Mhm.
for there is an environment that most of those people will that have high uric acid that would live in that would be ideal for them that would not cause an elevation in uric acid. And I think that's a big misconception. It's not that you have bad genes. Your genes will work optimally in a particular environment. Our ancestors would get fruits and vegetables, and they would eat that's when they got their higher fructose. They would start getting your high uric acid so that they could store fat. And then when winter came, then you go into fall. If you think about falls, it's probably not as higher in sugar, but it still has complex carbohydrates. Think of the foods we would get.
Squash, pumpkin, yep.
Yeah, it's a little bit. So now that's a good time to kind of have that baby, right? Or that's a good time to conceive. And
Yep.
then what would happen is that you would then you would go to winter. And if you look at what would happen in winters in certain regions, now you don't find the fruits and vegetables. You find the nuts and seeds, and then you would and then you would hunt. And there were no vegetarians back then. And then what would happen is in those regions, right? If there's nothing left else to eat, you don't find nuts and seeds, you got to eat something. So then what would happen is that then it sends a signal to the body to hold on to muscle. When you have more protein than glucose, your body is told store muscle. When you have more sugar than protein, your body is told store fat, right? So now they get lean up, they think better. And that's where our intermittent fasting comes in. They think better. Their muscles get stronger. They lean so that they can move fast and they can hunt. And then spring comes and it kind of cycles all over again. So I think that the big thing is, first of all, don't think that you need to do something forever and ever and ever. Think about what cycle makes the most sense for you in a yearly cycle in the different seasons. And I think don't look at it as bad genes. Look at it as everywhere where a gene may hurt you, it actually may help you in another situation.
That's such a reassuring way to think about it. And I love there's something very, I don't know, intuitive and aligned with thinking how you said in this cyclicity of how our bodies are working. So I think that's really beautiful. Anyone who's listening that wants to learn more, where can they find you?
At Dr. Elyaman, at DrElyaman on social
Love
media.
it. And you and I, we have dreams. We're going to do a part 2 where we're going to talk about homocysteine and methylation and genetic variability. So that'll be great. Everybody stay tuned for that. Dr. Elyaman, it has been such a pleasure to have you on the show. I learned so much. I always love chatting with you. Thank you for sharing your insights. We just feel so honored to be a trusted source of information for everyone who is listening. To our show's producer, Paola, thank you so much for making our dreams come true. And Dr. E, I can't wait to see you again for part 2.
Kalea, it's been a pleasure. I can't wait either. Let's do it.
Thanks for listening, everyone. We'll see you soon.
Bye-bye.
Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast where you can find more episodes on all things fertility.